The World Health Organization is urging countries in Eastern and Central Africa to quickly start vaccinating against yellow fever. The current outbreak has affected people in the Democratic Republic of Congo and Angola. Nearly 500 people have died and thousands have become ill. Health officials recently launched a campaign to vaccinate more than 14 million people in Angola and the DRC. The WHO says there have been no new confirmed cases in Angola in the past 6 weeks. But health experts are worried that the disease may spread to neighboring countries. The WHO is also urging other countries to launch similar mass vaccination drives. Yellow fever is a mosquito-borne disease that, among its symptoms, causes fever, vomiting, and fatigue.
We are planning to completely overwhelm the yellow fever strategy for the region. WHO has initiated discussions with Gavi, UNICEF, other partners, and the pharmaceutical companies that produce yellow fever vaccine. There will be need for preventive yellow fever vaccination campaigns in Central and East Africa, and to re-emphasize the importance of all countries providing yellow fever vaccine as part of routine immunization programs.
The World Health Organization announced Tuesday that an emergency committee on yellow fever will meet on August 31st to review outbreaks in the DRC and Angola. Now, Nigeria has launched an emergency polio vaccination campaign after 2 new cases of the disease paralyzed children earlier this month. The government says it will immunize 56 million children by November. VOA's Carol Pearson reports.
Getting all children immunized in northern Nigeria is difficult because of geography and conflict. As a result, hundreds of thousands of children may have missed getting the polio vaccine, allowing the virus to circulate quietly since 2011. The 2 latest cases of the disease, announced in mid-August, are similar to the strains that circulated 5 years ago. Polio is highly infectious. The paralysis we normally associate with it happens only part of the time, in about 1 out of every 200 cases. That means if 2 children are paralyzed, up to 400 could have had the virus, but without the crippling side effects. Nigeria was set to celebrate 2 years with no new cases of polio. In 1 more year without a single case, the World Health Organization would declare the country polio-free.
While this is late, unfortunately, in the process, it is actually the timelines built into that process that allowed us to see this now and now to respond effectively to it.
John Verdefe spoke by Skype from the Centers for Disease Control in Atlanta.
The certification timeline is a period of activity that focuses on making sure that any blind spots in the information are addressed.
Nigeria has put together an aggressive vaccination plan, starting in its northern states. The campaign will be synchronized with 5 neighboring countries. Nigeria then plans to vaccinate all other children in the country, some 56 million, in another campaign starting in October. As long as there are unvaccinated children, polio can survive and spread. The last thing anyone involved in the polio eradication program wants to happen. Carol Pearson, VOA News, Washington.
We turn now to research. A new gene vaccine that researchers say could be designed and developed in just 1 week can be customized to protect against any number of diseases, including Zika and potentially cancer. VOA's Jessica Berman has more.
Mosquitoes are one of the most common transmitters of disease, from Zika to malaria. Zika causes birth defects in babies. It's spread through the Americas from Brazil to Puerto Rico to mainland U.S. There's been a big scramble to develop a vaccine against it, and some are now entering clinical trials. Omar Khan, a chemical engineer at Massachusetts Institute of Technology, hopes his RNA vaccine will soon follow.
Things like, for example, Zika or the recent Ebola outbreak, we can rapidly respond to that within 7 days. So when there's an extraordinary need and you need something that is safe, then we have the ability to make that happen.
The vaccine uses messenger RNA to stimulate the immune system. Researchers can program this genetic material from a virus or bacteria to fight any disease-causing organism and bind it to a nanoparticle. It's an idea that's been around for a long time, but getting the vaccine into cells has been a challenge. So MIT researchers designed it to be as small as the virus it's targeting. Researchers believe they may be able to engineer the RNA vaccine package to fight a number of other diseases.
We are definitely very interested in trying to figure out whether or not these vaccines could be used to treat people with cancer, or even for patients that may be at risk for certain specific cancers. Maybe you could give them a vaccine so that they just wouldn't get cancer later in their life.
So far, the RNA vaccine has only been tested in mice. Researchers have started a company to promote the versatile RNA vaccine when it's available for people. Jessica Berman, VOA News.